The human body operates in a fairly narrow band of temperatures. Prolonged, unprotected exposure may raise or lower core body temperatures and cause health concerns that require prompt attention. Anytime a patient has been immersed in water, you should consider the possibility of hypothermia. The patient may be shivering and apathetic, have problems with motor skills, be stuporous with a slowed heartbeat, or completely unconscious. The best methods for rewarming a patient in hypothermia vary depending on available equipment, support, and whatever else needs treating at the same time. To begin the process, you need to prevent any further heat loss. Remove any wet clothing and get the patient dried off. Always handle a hypothermic patient gently. Rough handling can bring on cardiac arrest. When caring for the patient, you should maintain the ABCs. If CPR is necessary, you should rewarm while doing compressions. Passive rewarming is simple and effective for mild cases. Cover the patient with a blanket and let him shiver. Shivering is the body's way to rewarm itself. A patient who is conscious and can control his airway can drink warm fluids, although you should avoid caffeine or alcohol. For patients with moderate to severe hypothermia, you will need more aggressive warming strategies. This includes heat packs at the head, neck, armpits, and groin, along with warm water baths. On a boat, you can get enough warm water from the engine or compressor cooling system. There are 3 levels of heat-related symptoms, often brought on by vigorous exercise. Heat cramps are painful muscle spasms, most often in the calves, arms, abdominal muscles, and back. First aid for these symptoms includes rest, cooling off, and rehydrating. Stretching, icing, and massaging the cramps may help as well. Signs and symptoms of heat exhaustion include a rapid pulse, dizziness, anxiety, irritability, headache, and visual disturbances. The patient will also display normal to slightly elevated body temperatures and flushed, sweaty skin. If you are aiding a patient with heat exhaustion, you should keep him calm and cool him off slowly, get him out of the heat and into air conditioning if available. If he is conscious and in control of his airway, you can give fluids to rehydrate him.
Oh, man. Yeah, thanks.
All right, no problem.
Heat stroke is a more serious condition where the patient has a rapid pulse and red, hot, dry skin. The patient may also have a headache and exhibit weakness, dizziness, anxiety, or fatigue. You need to rapidly and aggressively lower the patient's body core temperature. You should remove his clothing and cover him with a cool, water-soaked blanket. Get him in air conditioning if it's available. To aid in cooling, you can also place cold packs in his armpits, groin, and along his head and neck to keep him cool.